welcome to the show. Today we are joined by Dr. Heather Shenkman. She is a board-certified interventional cardiologist in practice in Tarzana, California. She graduated from Albany Medical College in 1999 at the age of 23 through a 6-year combined BS and MD program. She completed a residency in internal medicine at Henry Ford Hospital in Detroit, and then cardiology fellowships at both the University of Rochester and Tufts University in Boston. She's the author of The Vegan Heart Doctor's Guide to Reversing Heart Disease, Losing Weight, and Reclaiming Your Life. While she is skilled at performing invasive procedures to open blocked arteries of the heart, she is a strong advocate for a healthy lifestyle, including plant-based eating and regular exercise. She's also an avid athlete, having completed 2 Ironman triathlons and over 100 endurance events, including triathlons, century cycling events, swim meets, and marathons. And she is the mother of 4-year-old Ava. So welcome to the show.
Thank you so much for having me, Emma.
Yeah, I'm so glad to have you here today. I first just wanted to start off by asking you what initially inspired your journey as a plant-based advocate.
So I've been vegetarian for a very long time, dating back to even high school. My younger brother, who is now an attorney, when he was 10 years old, he went to school and he was dissecting chicken wings, and he came home to us. He said, "I don't want to eat meat anymore." And I think maybe just me, I kind of ridiculed him, saying that was kind of silly. But as I thought more about it, I ultimately ended up deciding to be a vegetarian when I turned 16 years old. Around that same time, my brother's bar mitzvah was coming up, and my parents had wanted him to wear a tefillin. Now, the tefillin were my grandfather's tefillin, so it's not like any cow was currently being harmed. My father said to him at the time, "Okay, if you wear the tefillin for your bar mitzvah, I will go vegetarian." So this is around the same time as I became a vegetarian, and my brother wore the tefillin, and this is back in 1991. And my father has been a vegetarian ever since then. My mother followed suit because nobody was eating meat and there was no meat in the house. I ultimately decided to go vegan or plant-based about almost 19 years ago at this point. It was during my cardiology fellowship training. And of course, in cardiology, the majority of the disease that we see is lifestyle related. It's related to lack of exercise, poor food choices, smoking, stress. And I was reading about Dr. Dean Ornish and Dr. Caldwell Esselstyn, who used programs that involved plant-based eating to try to help people with coronary disease. And their data was compelling, demonstrating that a plant-based diet can really help people to do better if they have heart disease, and can actually also, as we've found, greatly reduce the risk of developing heart diseases.
Absolutely. We actually just had Dr. Esselstyn on. I don't know if you saw our episode, but we had him on. It was actually the day of his 90th birthday, so that was kind of special. So you should check that out.
Neat.
But great. And I like how you got the whole family involved too in it. Okay, so the next thing I wanted to ask you was, how do you respond to skeptics or individuals who believe that a plant-based diet is not sufficient for optimal health? Because animal welfare aside, that's the most common pushback I sort of hear. Like people who are on keto diets and stuff like that, and won't, like, I even saw this one girl on TikTok, she wouldn't eat carrots, but she would eat like a chicken wing. How do you respond to that?
I mean, that's a little out there to say you won't eat carrots, but you'll eat a chicken wing. I don't, I mean, that's coming from somewhere pretty weird. Surprisingly, in this day and age, I'm really not having to combat a lot of that. I think that as I've as the years have passed and there have been movies like Forks Over Knives and The Game Changers, I think people are becoming more aware of plant-based eating and the benefits of it. And I think it truly is more of a fringe that is into things like carnivore diets. And I mean, honestly, I'm not hearing as much about keto or paleo diets quite as much. The dilemma is that when you're consuming a diet that is high in animal products, particularly, animal fat and saturated fats, those those characteristics of diets are associated with an increased risk of cardiovascular disease. And on the converse of that, incorporating fruits and vegetables into the diet really has so many health benefits. And I think the majority of people definitely could benefit from eating more fruits and vegetables, regardless of their otherwise dietary pattern.
Absolutely. Well, I'm glad to hear that those sort of like fad diets are hopefully making their way out. Um, what scientific studies or research do you find the most compelling when you're supporting supporting the ideas of the health benefits of a plant-based diet?
Well, I think that there are studies that demonstrate that, consuming more fruits and vegetables and, leaning towards healthier, more plant-based diets, even some research regarding Mediterranean diets that, eating a pattern of diet that has less animal products and more fruits and vegetables tends to shape better health. Aside from just peer-reviewed studies, there's been a lot of look at areas of the world called the blue zones, where the characteristics of those populations is that they may not be strictly plant-based, but their diets are certainly far more in the plant-based direction. In addition to that, they have other positive characteristics of their lifestyles and that they move more, that they have more social connections, as well as eating fewer animal products.
Definitely. Um, well, I wanted to ask you, what advice do you have for someone who is considering adopting a plant-based lifestyle but is unsure where to start? Because it's like Veganuary, that's like really popular now, and we're definitely promoting, just try it for like a month. So, what advice would you have for someone?
I think it really depends on the person. I mean, there are some people I know who have gone like plant-based overnight. They see some documentary or they have some sort of health scare, and the next day they are plant-based and they never turn back or think about turning back. For others, it's a little more challenging. And for me, it actually took me a year to go from being a lacto-ovo vegetarian to being fully plant-based. And I think it's a matter of not just cutting out those foods, but of finding things that are new or different to eat in place of those things that you used to eat. So if you're somebody who really likes, having their milk and their coffee, finding the alternative that works for them, whether it be soy milk or almond milk, to put in their coffee. So, sometimes it's even just taking it one step at a time, like saying, I'm gonna just maybe starting with giving up dairy or giving up eggs or starting by giving up meat and then going step by step, sometimes taking on plant-based when you start from eating a diet that is fairly animal based is a big step.
Definitely, there's something to be said for not necessarily going, it's a poor choice of words, but 100% cold turkey.
Right.
Um, because I've also found in my own journey that doing like gradual steps is much easier to sustain.
Agree, absolutely.
Definitely. Well, thank you so much for hopping on today. And oh, did you want to talk a little bit about your book that you have?
um yeah, sure. I have a book, The Vegan Heart Doctor's Guide to Reversing Heart Disease, Losing Weight, and Reclaiming Your Life. I think it appears as a mirror image on the video,
On
but
my end, it's fine. So I think we'll be
oh,
good.
cool. Okay, so it's something I'm very proud of. It's a book that me. It really took me 7 years to put together. But what I thought to myself was, if I wanted to convey one message to my patients of how can I be healthy, whether it's starting from being concerned about my risk of heart disease or being somebody who's already had a heart attack and wants to, you know, do better when it comes to being a better patient. There's really three sections of the book. The first section talks about what heart disease is, what high blood pressure is, what cholesterol is, what diabetes is, and about those specific risk factors and some of the medications that we use. The second section of the book is about lifestyle and exercise. The third part of the book is about diet. And then at the end, really, it's about putting all of those things together and making the changes that you can sustain so that you can be a healthy person for the long term. So I'm very proud of it. I think it's a fairly easy read. It's not terribly technical. And I've talked to a lot of people who've found that the book has helped them in their health journeys.
That's amazing. Well, Mazel Tov on your book. Where can people find it who might want to buy it?
You can find it on Amazon. So if you Google my name and the word Amazon, it will come up.
Okay, great. Well, there you guys have it. No excuse. It couldn't be easier to get. Thank you so much again, Dr. Heather, for coming on.
Thank you for having me.
And I will make sure to link your book and your other website and stuff wherever this podcast goes up. So
Okay, great.
thank you. Have a great rest of your day.